Hi everyone, this is Anatomy and Physiology videos for healthcare students. In this video, we're going to talk about endocrine system and the adrenal glands. So to start with, let's locate those adrenal glands. They are sitting on top of each kidney, and you'll notice that there are two kidneys, so of course there's two adrenal glands. Let's cut into an adrenal gland and look inside. There's two regions. There's an outer cortex and an inner medulla or medulla. So the outer cortex region makes corticoid or steroid-based hormones. Let's go through the three regions called zonas. So zona glomerulosa is the most superficial region. It makes a class of hormones that are called mineralocorticoids. Hey, there's that corticoid suffix. Corticoid means I am a steroid hormone made by the adrenal cortex. Anytime you see corticoid, keep that in mind. Now, the prefix mineral tells you what we're regulating. We're regulating mineral content of the bloodstream. Things like salt, sodium, potassium. Zona fasciculata is the middle layer. That one makes a class of hormones called glucocorticoids. Hey, there's that corticoid again. That is a great reminder that we're dealing with a steroid hormone made by the adrenal cortex. Now, this time the prefix gluco sounds like glucose. That's what we're regulating. Glucose regulation over the long term, in addition to a few other functions. Now, the deepest of the three zonas is called zona reticularis, and it makes a class of hormones that are androgens or sex hormones. So from superficial to deep, I keep them in mind as GFR for glomerulosa, fasciculata, and reticularis. And of course, those three classes of hormones there, mineralocorticoids, glucocorticoids, and the last one is sometimes also referred to as gonadocorticoids. We'll go into more detail in just a moment. Let's also take a look at the medulla or medulla. That's made of neuroendocrine tissue that's found deep inside the adrenal gland, and this one makes two hormones, epinephrine and norepinephrine. Those are involved in the sympathetic nervous system response, which we often call fight or flight. So here's a summary of what we make by each region of the adrenal gland. The cortex makes corticoids. Keep in mind that says I am a steroid hormone made by the adrenal cortex. I've listed this time the most commonly known hormone for each class. When we talk about mineralocorticoids, you often hear us discuss aldosterone. Glucocorticoids, we often talk about cortisol. And then with the gonadocorticoids, we talk about androgens or sex hormones. They convert to estrogen and testosterone, but they're made in small amounts compared to what is made by ovaries or testes. And then looking at the adrenal medulla, we're looking at epinephrine and its sidekick norepinephrine. Those are alternately called adrenaline and noradrenaline. Okay, so keep in mind that corticoid tells you this hormone comes from the adrenal cortex. And to keep straight what each class regulates, keep in mind this little trick. The mineralocorticoids regulate salt, the glucocorticoids regulate sugar, and the gonadocorticoids regulate sex hormones or sex organs. So just a quick way to keep it straight, salt, sugar, and sex are coming from those three categories. That's what we're regulating. Let's take a moment to go into more detail. So mineralocorticoids, like aldosterone, regulate salt concentration in the bloodstream. So what do we mean by salt? Things like sodium and potassium concentration. These are electrolytes. So we're talking electrolyte balance in the bloodstream. Aldosterone also regulates blood concentration of hydrogen ions and bicarbonate ions. If you haven't yet covered acid-base balance, These two are going to influence blood pH. So hydrogens and bicarbonates mean we're regulating blood pH balance. And then finally, aldosterone or mineralocorticoids regulate blood pressure or increase blood pressure. You may know that increasing your salt intake also causes you to be thirsty, which will increase your water intake. So aldosterone ultimately influences blood pressure through its sodium retention. Okay, so that's aldosterone, mineralocorticoid. It's made by which zona? Glomerulosa, that's the outermost region. Let's now turn our attention to glucocorticoids, and we're going to talk now about cortisol. So glucocorticoids, like cortisol, regulate long-term sugar metabolism. These are not short, fast-acting glucose-regulating hormones like insulin and glucagon. These are maintaining it over a longer-term period of time. Glucocorticoids are also anti-inflammatory. This is the reason you may have cortisone in your cabinet at home, your medicine cabinet. You may use it for things like itchy mosquito bites or to reduce inflammation from a rash. So anti-inflammatory is often the reason we take, oral steroids to help reduce inflammation. So one of the issues with glucocorticoids is they can promote gluconeogenesis. This is a breakdown of fats and proteins into glucose. If you use a corticosteroid, like one of these for a long-term period of time, it can increase your blood glucose levels. And that's where we run into issues like Cushing's disease or diabetes. So the ultimate goal of glucocorticoids is to help us maintain stress resistance over a long-term period of time. All right, and the last category here, these are gonadocorticoids, otherwise sex hormones. These small amounts are produced throughout our lifetime, whether you are 5 years old, 55 years old, or 105, you're making small amounts of sex hormones, mostly androgens, in your zona reticularis. That's that deepest layer of your adrenal cortex. So these are converted to sex hormones, estrogens for female, testosterone for male, but they are poorly understood as to why we have them. But nonetheless, everybody has small amounts of these little sex hormones made by their adrenal cortex and zona reticularis. That's that deepest layer. Okay, so thinking big picture, why or how does these hormones get made? So the hypothalamus does have some control over hormone production by the adrenal glands, and that's going to be a negative feedback control through hormone production. So there are other mechanisms that play a role here. We're not going to go into them. We're just going to focus on this hormonal control. So if you talk about aldosterone and other courses, you may have heard of the renin, angiotensin, aldosterone mechanism. We're not covering that here since we're just focusing on these three classes made by the adrenal cortex. So hypothalamus makes releasing hormones like corticotropic releasing hormone, or CRH. That in turn targets the anterior pituitary to make adrenocorticotropic hormone, or ACTH. Releasing hormones come from the hypothalamus. Tropic hormones come from the anterior pituitary. ACTH in turn targets the adrenal cortex to make its three classes of hormones. But like I mentioned, there's other things that play a role here, including humoral concentration, and also we have things like renin-angiotensin mechanism that plays a role. So we're not talking about that right now, just about this hormonal control. Okay, so let's talk about how the humoral concentration, which means the blood concentration of certain items, can influence release of hormones. So blood concentration of salt, which is sodium or potassium, can influence the release of mineralocorticoids. You might recall that aldosterone was the primary mineralocorticoid that we talked about. So low levels of blood sodium can influence the aldosterone production and release from the adrenal gland. So aldosterone is an interesting one because it has multiple methods for being released, from hormonal to humoral, and of course, including that renin-angiotensin-aldosterone mechanism. And then finally, there is neural control going on for epinephrine and norepinephrine. When you are in fight or flight mode, this switches you over into a sympathetic division of the autonomic nervous system. That puts you into, I'm going to run for it or I'm going to fight for it. So fight or flight mode is neural stimulated. That means it's stimulated by your nervous system. So autonomic nervous system activates the adrenal medulla. The medulla releases epinephrine and norepinephrine, and since they can travel as hormones, that means they diffuse into the bloodstream. So they can travel throughout your body and they will communicate with target cells. Target cells are ones that carry receptors for epinephrine and norepinephrine. Well, I hope you enjoyed this video. If you have any questions, please leave them for me in the comments section. And if you like this video, please follow my channel. Thank you for watching.